If you're confused about knee arthritis treatment and you just don't know where to begin, you think there's maybe a bit too much information out there, or you just want to check that you're doing the right thing, if you keep watching, then we'll just go into the 3 key areas that I think are really important in this treatment for you. My name's Claire, I'm a physiotherapist from Physiofit Health. I've got over 15 years experience working as a physio in the UK and in Australia. We've got another video you can check out which is on tips on managing knee arthritis. So the 3 key areas that we'll go through are laying the foundations for your treatment, the different treatment options available to you, and taking an active role in your treatment, and I'll go into explaining why that's really important. So first up is laying the foundations for your treatment. Expect a lot of questions. Yes, about your pain. The healthcare professional should look into your joints and your muscles, but also expect some questions about your lifestyle as well, because stress, for example, can actually change the pain. So it can actually change the intensity of your pain. So lifestyle is as important as looking at the joint itself. Statistics on arthritis are quite staggering. There's a lot of people out there that are experiencing it, although everyone is different. To help illustrate some key points, we've got some hypothetical patients. Now they've both been diagnosed with arthritis. We've got Jill and Jim. So Jim's got knee arthritis and he really struggles to get up and down from a chair without any knee pain, and he can only walk about 100 metres or so he's quite restricted. Jill, on the other hand, also has knee arthritis, but she is actually able to run and walk. She can get a little bit sore the next day. As you can see, with Jill and Jim, they are both in completely different places with their knee arthritis. So when you go for your treatment, you just need to lay the foundations and the baseline of where you're at the moment. So that is your reference point. And then you can talk about where you actually want to go and what you need to do. So going back to Jill and Jim, Jim might just want to be a little bit more comfortable getting in and out of the chair, whereas Jill might want to manage her activities so that she's not quite as sore afterwards. So once you've laid your foundations and you've got your baseline of where you're at and then your idea of where you want to go, then you can talk about your treatment options. So that's the second key area to discuss. Broadly speaking, your treatment options fall into surgical, getting a knee replacement, or non-surgical options. With your non-surgical options, you do actually have a number of different options. So you've got exercises, stretches, you can do exercises at the gym, at home, you can do some activity modification. It just depends on you and your own situation as to which one fits best. So if we go back to our patients, Jill and Jim, Jim has a chat with his healthcare professional and he actually wants to go for a surgical option. But once they discuss everything, they actually find he hasn't really done too much of the non-surgical options available to him, and he's actually a little bit overweight. Now, the research suggests that if you lose weight, it actually can have a really good effect on reducing the pain in the knee. And so Jim and his healthcare professional just decide, whilst he's waiting for that surgical opinion, he can go into losing weight. Now his choices are, there's many choices available to him for losing weight. Could be that he sees a dietitian, he could try a little bit of exercise or swimming, but yeah, so he's got a number of different options available to him. Jill, on the other hand, she actually finds that stretches really help her, and activity modification. She gets hands-on treatment from her healthcare professional, but has a little bit of a chat about it, and finds she has other options that will do similar to the hands-on treatment. So she can carry on doing hands-on treatment, but she can do stretches at home, she can try the foam roller, she can even try a massage gun. And so Jill really feels like she's empowered just to make the choice as to which option suits her best. Last but definitely not least, the third key area is to take an active role in the management. In my opinion, understanding pain is the single most important thing you can do to really help in your recovery and management of arthritis. So that knowledge is power. So if you can understand what's going on, where you're going to, and all the different treatment options available to you, you can really effectively manage your symptoms. If you want to dive a little bit deeper into this, we do have a little mini training presentation on understanding a little bit more about managing your arthritis. The details to sign up are in the description below. So just to recap on your 3 key areas for knee arthritis treatment. One is that you need to lay the foundations to get your baseline and where you want to go, which then leads you on to the second key area of the different treatment options. So you need to figure out which one actually fits you and your own situation. And the third one is taking that active role and just understanding a little bit more about your pain. It just means that you're a bit more empowered to do the right thing for you. Don't forget to sign up to the mini training just to find out a little bit more about your knee pain and managing arthritis. Share this video with anyone you know that would benefit from understanding a little bit more about what to expect from treatment. You can schedule a telehealth appointment with us through a link on our website. So remember, knee arthritis treatment should be tailored to you. Thanks for joining me, and I'll see you soon.